As a competitive triathlete, Bob enjoys a wide range of strenuous activities. But with a long history of painful and severe hemorrhoids, Bob's ability to enjoy his daily activities was becoming more and more challenging.
I've had hemorrhoids for many years, probably 30 years. More recently, I've managed the symptoms by doing complete cleanup after every bowel movement. That works okay if you're home all the time, but when you're at work or in the public, you don't always have the opportunity to do the complete cleanup. Consequently, I would have burning and itching if I didn't do the cleanup.
In the United States, it is estimated that 50% of men and women will sometime in their life suffer from hemorrhoids.
Hemorrhoids occur naturally in the body as arteriovenous complexes. Hemorrhoids can be classified as either internal or external. When the hemorrhoidal tissue grows, it can become swollen due to constipation or any other type of straining. The hemorrhoids can get enlarged, hang out through the anal canal, bleed, and cause great discomfort.
While they typically occur in people over the age of 50, hemorrhoids can affect anyone at any age. Straining, sitting for long periods of time, chronic diarrhea or constipation, obesity or pregnancy can lead to hemorrhoids.
Broadly speaking, there are two types of hemorrhoids: external, that occur outside the body, and internal, that are present inside the body. External hemorrhoids can become thrombosed and form a blood clot that is intensely painful and may need urgent treatment. On the other hand, the internal hemorrhoids can become engorged or swollen and even become prolapsed, which means they hang out through the anal canal and cause bleeding, irritation, and significant discomfort.
In most cases, hemorrhoids go away on their own and can be treated with conservative measures like topical creams and changes in diet. But in cases where the hemorrhoid is prolapsed, more treatment is often needed in order for the discomfort to subside.
Traditional hemorrhoid surgery involves cutting out the hemorrhoid tissue. This is an extremely painful operation and the recovery can be several weeks. Patients have a lot of discomfort with this type of surgery, especially when they move their bowels, and there's also some drainage while the wound heals. Getting back to their normal activities can take a very long time.
But for patients like Bob, an increasingly viable alternative is available called THD. THD uses a uniquely designed scope and Doppler to locate the terminating branches of the hemorrhoidal arteries. Once the artery is located, the surgeon uses an absorbable suture to tie off the arterial blood flow.
The venous outflow remains to shrink the arteriovenous complex. THD is done without any incision or cutting of the tissue. The surgeon may elect to form a hemorrhoidopexy that will lift the remaining tissue into the anal canal.
I believe I was one of the first in the Hornell area to have the procedure. I experienced no pain during or after the surgery. The only thing I experienced, I believe it was the next day, was some sort of an aching sensation, which I had for a couple of days, but the ibuprofen was enough to alleviate that aching sensation. I absolutely felt no pain. I mean, in a sense, it was almost as if nothing had happened.
For Bob, the procedure has given him the ability to restore his normal active lifestyle.
I'm a competitive amateur athlete, and riding my bicycle and running is much more comfortable now without the burning and the itching. So the procedure basically has taken me back probably to the time when I was probably about 25 years old.